Bladder cancer symptoms is where growth of abnormal tissue, known as a tumor, develops in the bladder lining. In some cases, the tumor spreads into the surrounding muscles. The most common symptom of bladder cancer is blood in your urine, which is usually painless. Here are symptoms of bladder cancer. 1. Blood in your urine. This is the most common early symptom of bladder cancer, and it's an easy one for women to overlook, especially because it's typically painless and you can go weeks or even months between occurrences. Many women ignore the symptom because they connect it with menstruation or menopause. 2. UTI-like symptoms. Bladder cancer can often be mistaken for a urinary tract infection, because many of the symptoms overlap. Patients may experience increased frequency of urination, urgency to urinate, pain with urination, or urinary incontinence. 3. Unexplained pain. Pain is often associated with more advanced bladder cancers. The pain can be in the flank area, abdomen, or pelvis. Patients can also develop pain in their bones if the cancer has spread to their bones. If you're having aches and pains in those areas, tell your doctor, especially if you've also had the aforementioned spotting or UTI symptoms. 4. Decreased appetite. Appetite loss is a common cancer symptom, and bladder cancer is no exception. If the cancer has grown or spread, you might have weight loss or feel tired and weak. Of course, there are plenty of other things that can mess with your appetite, so don't automatically assume the worst, but do talk with your doctor about it if it persists. 5. Smoking. Okay, so this isn't technically a symptom, but according to the National Institutes of Health, about 50% of women diagnosed with bladder cancer are smokers. Smoking is the biggest risk factor for bladder cancer. If you notice any of the above symptoms and you smoke, let your doctor know ASAP. Because it's easy to chalk up the symptoms to a stubborn UTI or normal spotting. Thanks for watching. Subscribe us to get more health tips.